Let's welcome Dr. Sadak.
Thank you, Mary. Let's see. Can everybody hear me okay? Good afternoon. Thank you so much for being here, and thank you for the opportunity to talk to you about subject that's very near and dear to my heart, self-care. So what is self-care? There are some facts about self-care that I want to share with you. First fact is that most care partners prioritize caring for a person living with dementia for their care recipient over their own self-care. And this fact is probably well known to you as a care partner. We learned about it after interviewing 100 care partners of people living with dementia whose loved one recently experienced a hospitalization. And we asked them to inventory their own self-care practices and to tell us how and if they maintained their self-care when their loved one was in crisis. And what we learned is that every study participant, all 100 of them, significantly reduced or completely stopped their self-care when they were attending to the acute needs of their loved one. What we also know is that most care partners reduce self-care when in crisis, but also that crises happen quite often. And then there is big crisis, there are small crises, there's frequently unexpected things and changes that make caregivers stop prioritizing themselves. Another important fact is that different cultures have different views of importance of self-care and even acceptability of self-care. And we learned this when we were developing a measure of care partner activation, where we were asking care partners, what do you do to meet your own needs? And now ethnic minority caregivers, specifically Hispanic caregivers, said, this is not an okay question to ask, because as a daughter, it is my privilege to care for my mother who lives with dementia. I'm not supposed to talk about my own needs. Like, this conversation is no longer to be had when I take on the privilege and responsibility of calling myself a caregiver. So it's really important to understand how the environment, the culture, the family expectations shape our own views of self-care, and is it even acceptable for us to be practicing self-care and talking about it. Next fact is that in order for self-care to be effective throughout caregiving trajectory, and in order for it to be sustainable, we need to cultivate self-care habits. That doing something to meet your own needs once in a while doesn't seem to have as much of an impact as having a habit of even small self-care practices that are done regularly. And the last fact, and kind of my assumptions and beliefs that I want to share with you that serve to underline many things that I'll be discussing with you today, is that care partner self-care is essential for both care partner and the care recipient person living with dementia, because caregiving journey in dementia is a really long-term journey, and sustainability of energy and effort is very important. So here's my attempt to give you a little bit of a visual representation of why I think self-care is absolutely crucial. So we start out our caregiving journey shortly after diagnosis, feeling some energy, feeling some enthusiasm, having ideas, having passion, and people reach out to us. They offer help, family, friends, other resources. People want to know what they can do. They empathize, with our changing situation, and they show up for us. After some time as a caregiver, you start feeling tired. You start feeling that there's maybe less enthusiasm. There's more frustration. And people don't reach out as often. After a few months, few years, people just don't volunteer to come and help. And then you have to decide, is this really, really important? Do I want to tap into my resource, or do I want to save it for the next time when there could be bigger crisis. And eventually, if you don't have sustained practice of doing something that sustains you, you have little to give. And at times you don't even have energy to ask for support. So this is why I advocate for sustained self-care practices. All right, so what does it take to develop sustained self-care practice? And step one, you need to start with an inventory. And before you inventory your practices that you're currently engaged in, you have to kind of inventory, what are your views on self-care? Is it important to you? Is it important to you enough to prioritize giving it time, sometimes your most crucial resource? What is the environment in which you can practice self-care? And then, big question and more of an existential question, do you deserve self-care? Do you deserve giving yourself the time and the attention on a regular basis? And then you start inventorying your practices. What is it that you currently do? Then you set objectives and measurable goals, and we'll talk about it for a bit. And then you work on developing habits. And the whole goal with habit is to develop automaticity. In the beginning, when you start introducing new practice, it takes effort, it takes time, it takes thinking. It's a disruption. But the goal is for it to be automatic, and we'll talk a little bit about mechanisms for doing that. So step one, you start with asking yourself a question: what is self-care to me? Our definitions of self-care would be very, very different. And that's a very important starting question to ask yourself. Then you say, okay, where do I place the importance of self-care for myself? And then you inventory your current practices. And after you inventory your current practices, you identify your gaps and you ask yourself, what are my current obstacles? And I like the quote that the hardest part of solving a problem is accurately defining it. And my team and I spend quite a bit of time in developing tools that could help care partners of people living with dementia accurately define the problem and to set goals. So we developed measures that were named Managing Your Own Wellness, or MEOW. And this measure has 3 domains of self-care practices. One is universal. You got to do it if you want to survive. You got to live. It includes categories from eating, drinking, sleeping, taking care of your own medical needs. Here's some examples on the left. Second is health promotion. This is universally what we all could be doing if we feel so inclined to maintain optimal health. Meditating, praying, spending time with others whose company we enjoy, listening to music, watching TV, engaging in outdoor activities. And the third domain, really specific to dementia caregiving, we call it care partner domain, is how do you practice self-care in a context of your caregiving responsibilities? Do you enjoy in pleasant activities with your care recipient? Do you get specific caregiver support, and do you have a caregiving community that can help you thrive? Do you ask for help when needed? And do you engage in meaningful conversations and partnerships with healthcare providers of your care recipient? So we developed this inventory that care partners can fill out, and I'm happy to make that available to you with the slides, that you can inventory your own self-care. And we ask you, how often do you practice these self-care practices day to day when things are going as expected or well? And then how often do you practice them on a bad day? And that's the biggest indicator, because when you set your self-care goal, you want to identify what is important to you that you're currently not practicing regularly, that you want to sustain when in crisis. Because according to our studies, majority of self-care practices get dropped when in crisis. And we can't expect you to practice your full self-care routine in an acute or critical situation. But if you can identify some priorities, then you can start working on developing habits towards sustaining those important things. Okay, step 2, goal. How do you set a goal? Another good quote: new goals don't deliver new results, lifestyles do. Which is very interesting from the perspective of social psychology. Setting a goal in itself is giving a person the optimal pleasure, the optimal dopamine release. Achieving a goal doesn't seem to be as rewarding, but incorporating the new action into a lifestyle is what pretty much the only outcome that gives change that's sustainable. So we'll go back. We looked at our inventory. What is our self-care priorities? What do we want to do more regularly, more often? What is the big goal? What is the big vision? But in order to achieve a big goal, we have to identify the first step. It seems very simple, but once put in practice, it's very, very practical chain of events. And once we identify the first steps, what is the logistic? What is the action? What is the timing? What is the location? How can we make this goal measurable? So you will identify an action, you will name it, and then you have to attach the time and location before you can put your plan into action. And the third step is, how do you develop a habit? Your habits are perfectly designed to deliver your current results. So if your current results are not satisfactory to you, we need to work on new habits. So we identified action and location, and I'll give you some examples in a minute. And then the most helpful way to develop a new habit is to identify something we're already doing automatically every day, all the time, at about the same time, at about the same location. So then we can tag on this new action to something that we already don't even have to think about. And that's what makes it sustainable, especially when we practice over time. So this is a practice called habit stacking. After I do current habit, I will do the new habit. And here's an example of how this works. I'm going to cultivate a new habit of meditation. I would not attempt to perform an all-day meditation on my first day. On July 1st, I will set a goal that I will meditate for 5 minutes in the living room after I make my morning coffee. So immediately, I know I make coffee every day. I never skip a day if I can help it. After I've made my morning coffee, I don't do anything else. I use my willpower. I go and I sit down for 5 minutes. I set my timer, my 5 minutes up, I'm out. On August 2nd, I will meditate for 10 minutes in the living room after I make my morning coffee. And I go and I go and I go with the goal that in November, I can become a master meditator and probably teach meditation workshops. But this is an idea. It's very intuitive. It's very straightforward, but it's the only thing that works when you're very busy, when you're very overwhelmed, when your life is unpredictable, because you never know when you're going to be needed. So setting these tiny actions is super important. And the kind of last theoretical piece I want to discuss is kind of what are the layers of behavioral change? How does behavioral change work? And we start with this outer layer, the outcomes. Pretty simple. We could think of what outcomes we want to accomplish with our new habits. And we'll start building a process that leads us to this automaticity where we no longer have to make an effort to do what we need to do. But most important part about developing new habits is forming the identity. So I would invite you to not only use the inventory of self-care practices, but also think bigger, like what is your identity? If my identity, my goal identity is to become more calm and mindful, this is my big goal, this is my identity. I want to be able to sustain my calm, and I want to just sustain my energy and my attention, even when life shakes me up. This is my goal identity I would aim towards. What would be the process to get me there? What would be the outcomes and what would be the actions? So this process, you have to kind of work backwards and forwards to develop the best action plan. So this is kind of the primer on behavioral modification, habit formation. I highly recommend this book by James Clear called Atomic Habits. A lot of the principles in this talk were informed by James Clear's very clear step-by-step plan for developing and sustaining new habits. And I want to invite you that if you were interested in developing some of your own self-care habits, we're currently recruiting care partners of people who are living with dementia at home, who are caring for their loved ones in their own homes or assisted living facilities, who are really motivated and want to improve their self-care. So we're enrolling care partners in a 12-week study where we help you do the self-care inventory and set a goal, and then give you a call once a week for 4 weeks, and doing some coaching and helping you achieve your goals, and also give you access to this really easy to use interactive web portal where you can track your daily actions, your steps, your goals, and your obstacles, and working with a behavioral specialist who will help you come up with a game plan on how to overcome those obstacles. So if you're interested, here's information for our wonderful geriatric social worker, Emily Shadow, that you can contact if you wanted to learn more. And these slides will be available to you after the talk. And right now, I want to open it up for questions.